Antacids. We all have used them at some point, so which one should we take? This experiment aims to find out. The first step was research. An antacid is a substance which neutralizes stomach acid, and there are three main types: magnesium hydroxide, calcium carbonate, and aluminum hydroxide. From this, the question was created: which antacid is most effective? The goal was to test this in two different solutions. One solution is used by pharmaceutical companies to test drugs, and the other is a variation of that. The antacids tested were Tums, Pepto-Bismol, milk of magnesia, Rolaids, and Alka-Seltzer. The hypothesis was that an antacid with magnesium hydroxide, like milk of magnesia, would be most effective. This hypothesis was based on the research mentioned before. The independent variable was the type of antacid tested, and the dependent variable was the pH of the solution after the antacid was added. These materials contain the antacids tested, the solution each antacid was tested in, the equipment used for testing, and safety materials for the safety of those involved or near. These procedures are for the two different solutions that each antacid was tested in. The difference is that the upset has 3 times the hydrochloric acid. This is the procedure used to test each antacid. This procedure was followed exactly through every test, and each antacid went through this a total of 4 times, twice with each type of simulated gastric juice. Each test showed similar results, though they were unexpected. Milk of magnesia immediately turned the solution to a base. Pepto-Bismol and Rolaids barely changed the pH at all, and Tums and Alka-Seltzer ended up in a good range. The first upset test showed similar results, although the final pHs were just slightly lower because of the starting pHs. The second regular test showed similar results to the first, which showed that the results were most likely reproducible. The second upset test showed, again, similar results to the first, proving the results were most likely reproducible. This experiment has a lot of relevance to society. A lot of people use antacids, and a lot of the commonly used antacids reacted differently in these tests. This experiment found many different results. Pepto-Bismol did not work as an antacid and did not change the pH by much. Rolaids did not dissolve, nor did it really change the pH. And milk of magnesia worked very well. It changed the pH a lot. However, it changed the solution to a base. Alka-Seltzer worked great as an antacid. It changed the pH to a good number for the stomach to be at. Tums worked well. It was effective in changing the pH, and it raised the pH to a good number. So Tums and Alka-Seltzer proved to be the best.